Welcome back, everyone. This week, we are going to be exploring the topic of mental health and illness further, specifically examining the role of communication. According to the Center for Disease Control, mental illness is defined as any diagnosable disorder that impairs a person's mood, thoughts, and/or their behaviors. Mental illness impacts people at all ages. Statistics show that approximately 1 in 4 American adults suffer from some form of mental illness at any given time. As we will talk about in a moment, the stress that children and adolescents experience can contribute to the statistic that 20% of youth live with a mental illness. While mental illness is a broad term that is inclusive of many categories of mental conditions and health, reports show that anxiety and depression are the most common and the most common experienced within the emerging adult population. According to the August 2018 Stress in America survey conducted by the American Psychological Association, Gen Z, or youth ages 15 to 21, report high amounts of stress from many different categories. First, youth are concerned with normal life stressors, such as doing well in school or at work, sometimes managing performance in both areas, maintaining a healthy lifestyle and relationships with others, and earning enough money to afford the things they need and want. However, Gen Z also faces unique stresses related to the current historical climate. For example, youth today worry about mass shootings in their communities and schools. Furthermore, Gen Z reports worrying about these issues much more than other age groups. Other stressors in this category include substance abuse and the opioid epidemic many communities across America are facing. According to the APA report, roughly half of Gen Zers report at least one person they know struggling with drugs and alcohol. Further adding to the stress is a lack of resources or perceived avenues for help these youth experience. Finally, the report says that Gen Zers experience significant stress over the state of our nation, including the current political climate and the information they hear about in the news related to public policy and sexual assault. When it comes to coping with this stress, 1 in 4 Gen Zers say they do not do enough to manage their stress, and 3 in 4 say they could use more emotional support from those close to them in managing their stress. This is concerning since support from friends and family is the primary way in which youth manage stress. Thus, it may not be surprising that according to the APA report, nearly 9 out of 10 Gen Zers between the ages of 18 and 21 report that they have experienced at least one physical or emotional symptom due to stress, including feeling depressed or feeling nervous or anxious in the past month. Furthermore, Gen Z reports that they more likely than any other age group seek help from psychologists or mental health professionals. Some of you may be asking why this course is being offered in the Department of Communication Studies and not psychology or nursing. Well, as we've already talked about, the study of mental health is interdisciplinary and includes a lot of perspectives on the issue. This class will focus on the communication that occurs surrounding the topic of mental illness. As you read in your readings, communication is an extremely important factor when studying mental health and illness. Specifically, communication scholars who study mental illness help shape our understanding of how we communicate with others about mental illness. For example, they help us understand how certain co-cultures may stigmatize mental illness. Recent research has shown that military personnel experience unique challenges when communicating with others about wanting or needing to seek professional help for symptoms of PTSD, just to provide an example. Second, language or how we communicate about mental illness has serious implications for how we understand mental illness and treat others diagnosed with mental illness. Last week, I previewed the concept of stigma and how stigmas are created, maintained, and changed via communication. This week, you read about some of the specific stereotypes of mental illness that are present in media portrayals of mental illness. These often inaccurate portrayals may contribute to the current stigma associated with mental illness. Third, communication with others and establishing relationships is an important factor in maintaining good mental and physical health and well-being. Communication is directly relevant to establishing and maintaining relationships, which are important to maintaining good mental and physical health. Finally, mental illness can have a direct impact on how people communicate with others. Those managing a mental illness may experience challenges communicating with others in this way. Furthermore, those close with someone experiencing a mental health condition may need to adopt unique strategies when communicating with their loved one. These last two factors are especially relevant to the relational lens in which this course will examine communication about mental health. A relational lens or perspective to examining communication and mental health assumes that human understanding and behavior arise from our interactions with other people, particularly people in close relationships. Your readings for this week discuss some important research which establishes the importance of communication in relationships where one person is managing a mental illness. First, the interpersonal theory of depression suggests that individuals diagnosed with depression may communicate in less positive ways with their partners. Thus, their partners may be prompted to reciprocate that negative affect. Unfortunately, this negative pattern of communication may further contribute to the person's depressive symptoms. Second, communication research has demonstrated that how people label mental illness in their relationships is important for the types of support they give and receive. Specifically, in romantic relationships, when depressive symptoms were labeled as problematic enough to seek professional help, their partner's communication about the depression became less negative and more positive. In other words, when depressive symptoms were labeled as an illness that needs treatment, then support partners were more likely to engage in supportive communication about the mental illness as opposed to negative messages such as, "just suck it up and come out with me." Together, these studies highlight the importance of communication, especially interactions in our relationships that influence our mental health and management of mental illness. We will focus more specifically on social support in the final 2 weeks of this course.